Question number 1. Which of the following conditions lead to tissue hypoxia? Okay, without alteration of oxygen content of the blood. So which of the following condition leads to tissue hypoxia without altering the oxygen content? It means oxygen content is okay, but there is a hypoxia. So it can be asked like a one-liner, it can be asked like a conceptual question. So carbon monoxide poisoning, meth hemoglobin, cyanide poisoning, or respiratory acidosis. So we have seen that plenty of MCQs are based on hypoxia, and they have almost the same concept. For example, if we say carbon monoxide poisoning, or we say anemic hypoxia. So anemic hypoxia can be due to anemia when hemoglobin is less, number 1. So either hemoglobin is less, that is why transport of oxygen will be less. So see, number 1, if someone is at mountain, it is called as hypoxic hypoxia. If someone is at mountain, it is called as hypoxic hypoxia, because at high altitude, pressure of oxygen will be less. So if barometric pressure will be less, pressure of the oxygen will be less, and even the content will be less. So that is called as hypoxic hypoxia. Second is anemic hypoxia. So in anemic hypoxia, what we see, either hemoglobin is less or hemoglobin is busy with someone else. For example, see, hemoglobin and oxygen are the best couple in the world until hemoglobin has seen carbon monoxide, because now the love will be 210 times more for carbon monoxide. So although we have enough hemoglobin, but hemoglobin is busy with carbon monoxide because of the affinity with the carbon monoxide. So carbon monoxide poisoning is also called as anemic hypoxia. So if there is less hemoglobin or anemic hypoxia, automatically content will be reduced. In meth hemoglobin, what happens? Instead of ferrous, okay, there is ferric in the hemoglobin, and this has less affinity for oxygen. This has less affinity for oxygen. So again, oxygen content will be reduced. So either hemoglobin is less or carbon monoxide poisoning. They are called as anemic hypoxia. And in meth hemoglobin, there will be hypoxia and content will be reduced because ferric has less oxygen carrying capacity. In cyanide poisoning, okay, it is called as histotoxic hypoxia. What is meaning of histotoxic hypoxia? Immediately what should come to your mind? There is not problem in the content of oxygen. Problem is with the oxygen utilization. Problem is with the oxygen utilization. Okay, so the only hypoxia which is seen here where oxygen content is reduced, answer is going to be cyanide poisoning. You are correct, doctor. Very good. Answer is C. So you know that. Excellent. So hypoxic hypoxia, high altitude. Anemic hypoxia, either anemia is there or carbon monoxide poisoning is there. Third is stagnant hypoxia. If cardiac output is less, what is that called as, doctor? Stagnant or ischemic hypoxia. And the fourth variety, where there is no problem with the oxygen content, but problem is with the oxygen utilization, cyanide poisoning, because cytochrome will be affected, so oxygen utilization will be poor. So answer will be cyanide poisoning. You are absolutely correct. Very good.